The question we will raise is, can plant-based nutrition heal the autoimmune disease? So this story is about a 30-year-old lady who presented to us initially with multiple autoimmune diseases, hypertension. She had been diagnosed with type 2 diabetes, and she presented for wellness intervention. So even though she knew we were a cardiology practice, she knew about some of the things that we did. And so she wanted to make these changes. And so she had a long, complex medical history. She had health issues that surfaced as a teenager. Before these diseases started to control her life, she was the MVP of her junior high school basketball team. She was told by coaches she could play in college if she continued. However, she started developing dry, itchy skin, had trouble breathing when playing sports, and had painful lumps appear on her body, and started having severe headaches. She saw many neurologists, dermatologists, and rheumatologists trying to figure out the cause of these symptoms. She frequently went to the emergency room and was hospitalized a number of times. So she saw different ologists. She tried to fail Botox injections for migraines, IV steroids, oral steroid medication. At one point, some physicians wanted to put her in induced coma. Both her and her mother did not like this idea. Instead, she took IV steroids at home, up to 120 milligrams daily, to reduce the pain from severe migraines. She had missed high school so much that she had to get a GED and did not complete high school with her fellow classmates. She had to leave school trips due to unmanaged pain and had to be hospitalized many times. She struggled into adulthood to manage her pain over the next several years. Now her musculoskeletal pain and skin change were more severe. Doctors told her she had different diagnoses ranging from lupus to fibromyalgia to various forms of arthritis. Her ultimate diagnoses were psoriatic arthritis, rheumatoid arthritis, asthma, Raynaud syndrome, hidradenitis suppurativa. She took on a lot of injectable medications, powerful immune-modifying drugs, biologics, and painkillers. Her severe pain caused hypertension, and steroids caused diabetes. The common finding. So not only was she hospitalized in order to receive IV medications to reduce her inflammation, but she also had hospitalization due to side effects of medication she was prescribed. She tried countless biologic medications to alter the immune system response to chronic autoimmune and rheumatoid diseases. These medications cause heart failure, liver failure, debilitating nerve damage, worsening skin lesions, cancer, and life-threatening infections. Side effects of some of the medications, again, to list as a laundry list: injection site reactions, infusion reaction, neutropenia, infections, demyelinating disease, heart failure, pulmonary disease, hepatotoxicity, cutaneous reactions, including psoriasis and malignancy, among a few. So many of the biologic prescription medications that were used to treat her autoimmune diseases also weaken the body's ability to fight off infection. Unfortunately, this caused her to develop severe fungal lung infection. She was hospitalized on IV antibiotics for a month in addition to steroids and probably antifungals as well. She also required IV and oral steroids so frequently that she developed type 2 diabetes. Long-term steroid treatment has many other serious side effects, not only increased blood sugar, but hypertension, weak bones, cataracts, weight gain, acne, gastric or intestinal ulcers, as if she needed more health issues. Here's some pictures of her in the hospital. So here's a PICC line. Here is an accurate check of her blood sugar, 381. So she took 800 milligrams of ibuprofen 3 times a day for 6 years due to severe pain. She also, during this time, was caring for a child who was in hospice for 2 years. This can potentially be very damaging to the kidneys, but she had no other option. She could not manage her pain somewhat. She could not properly take care of her child. She was recommended to try plant-based diet and try it on her own. She did not have time caring for her sick daughter to put her own health first. Finally, in 2021, she realized she needed to try again and change her diet as a last resort, and went to Montgomery Heart and Wellness after being referred by a friend. So just an overview of some of the ailments: psoriatic arthritis. Psoriasis is basically a systemic inflammatory condition, which can affect the nails, skin. You can have scaly, itchy, patchy skin lesions. It affects joints, of course, causes musculoskeletal inflammation, causes inflammation of the spine, deformity of the fingers and hands, extreme swelling of fingers or toes, pitting or lysis of the nails, and painful inflammation of the tendons. Now, you can see some of the classic signs of nails. People with psoriatic arthritis have those little pinpoint dimples in the nails. You can see those. And then, of course, red rash is very itchy and scratchy, can predispose to infection or worsening inflammation. What is rheumatoid arthritis? Rheumatoid arthritis often first causes inflammation of the proximal interphalangeal joints or metacarpal phalangeal joints and leads to swelling, pain, and debilitating deformities. The patient, part of only about 15% of patients with arthritis who have both psoriatic and rheumatoid arthritis. Rheumatoid arthritis also can cause inflammation, not isolated to the joints, but even inflame the arteries, spleens, sclera of the eyes, or pleural lines of the heart and lungs. Now, let me pause here because I'll go through a few other diagnoses. These arthritides are named as such just based on certain clinical findings that we have. They're all next kin. And so if you have inflammation of certain joints with a certain presentation, we give it a certain name. They have inflammation of other areas, you give it another name. So just because we have these different names, it's really one condition. So I just want everybody to understand that we have different labels, but just one condition. Now, here's some examples of X-ray malformation of joint erosion and progressive rheumatoid arthritis. And you see what we call ulnar deviation, where the bones bend over toward the pinky finger. Hidradenitis suppurativa is a chronic inflammatory skin condition that affects the intertriginous areas of the axillary, groin, perineal, and inflammatory regions. It causes recurrent inflamed nodules, abscesses, and draining skin tunnels. Below are examples of different stages of disease of the axillary region. Again, this is inflammation that attacks a certain part of the body, glands, lymphatic tissues, and so it has a certain clinical manifestation. Still the same disease, but a different name because of different clinical manifestation. Raynaud's phenomenon is an abnormal and exaggerated vascular response, again, inflammation in tiny blood vessels. It responds to emotional stress or cold temperatures. A classic presentation is that you get severe pain in the tips of your fingers when you hold a cold drink. The digits can become discolored due to abnormal constriction of the arteries in the fingers and toes and abnormal constriction of the arterioles of the skin. This causes pain, throbbing, tingling, numbness. So you can see severe discoloration, severe pallor here. You have cyanosis or blueness of the tips here and severe hyperemia, redness there. So intense vasoconstriction causing pale fingers, as I pointed out. Hypoxia, the venous stasis here, and intense red discoloration due to reperfusion hyperemia, which you see here in C. So these are just abnormal vascular responses as a result of very poor vasomotor tone or really irritated tiny blood vessels. So Ms. Mann was ready to try nutritional detox. Her blood pressure was elevated at 131/85, her weight was 204, and BMI was 33.94. She needed a lower blood pressure and sugar to reduce her pain and swelling and improve her gut health as she suffered from constipation and nausea regularly. She also had shortness of breath with exertion and intermittent chest pain. So you can have vascular abnormalities in the coronary arteries as well as other vascular structures in the cardiovascular system. Below are some of her medications she took. Some hormones to help with conceiving, hydroxychloroquine and muscle relaxants for her autoimmune diseases, and medication for anxiety. So you say Humira was a biologic agent, Atlantis, insulin, for insulin, and of course she has steroids, induced type 2 diabetes, to ibuprofen, as we talked about before, nifedipine, blood pressure famotidine, proton pump inhibitor. Her initial testing showed good kidney, liver, and thyroid function, and a normal hemoglobin A1C. However, inflammatory marker CRP was 2.7. Now, the blood inflammatory marker, you look here, it says, wow, 2.7, but she was on medication that suppressed the inflammation, but despite that, she still has elevated C-reactive protein, and this is at the blood level, and the inflammation at the tissue level may have been even worse. She had normal treadmill stress testing, good ejection fraction on the echocardiogram, and she had mild diastolic dysfunction. So she really had no business in a cardiologist's office. She didn't have severe heart disease, but the systemic problem was really the major issue. So she started the raw plant-based detox February 16th of 2022. We instructed her not to take any insulin due to normal glucose on our assessment. Now, the immediate discontinuation of insulin is a very important thing because when someone gets on the raw diet, the blood sugar is at risk for dropping really fast. You can always give insulin, but you can't take it away once you've given it. And so we rather risk having the blood sugar run high. So let's say she missed it the first day or two and it came back 300. we'd have been okay with that because you could always give it. But if you take it and you're on a raw detox, it drops to 5 and you're in a coma, it's hard to kind of reverse that. So we frequently stop it, especially when the baseline blood sugar is normal and you go on the detox diet. So after 2 weeks, she lost 10.5 pounds. Home blood pressures were consistently around 115/80. Because of the lower blood pressure, reduced her nifedipine from 60 milligrams once a day to 30 milligrams. Now, this is what really excites me, being able to reduce medication. Now, 10.5-pound weight loss in 2 weeks is great, and I love seeing people lose weight, but I'm super excited when we can use medications very quickly because that makes a big, big difference in overall health and the biochemistry of what's going on. One, it's a sign that their favorite biochemical and physiological change is happening, and two, it allows us to further rapidly detox on it. When we can remove a foreign chemical from your body, it allows the body to heal faster. She was not on insulin anymore, and glucose levels range from 90 to 135. So had we left on insulin, those blood sugars may have been super low, and she may have had symptoms of hypoglycemia. During 2 weeks, her constipation was getting better as she was having more regular bowel movements. Her skin became clearer and smoother. However, she did go to the pulmonologist for an asthma flare and was started on 2 different inhalers. Sometimes at the initial phase of detox, toxins leaving the body, some symptoms get worse before they get better. Oftentimes people, especially with pulmonary condition, but any condition, when the body's cleaning itself, you can cough up. So we've detoxed a number of people with chronic lung disease. And while they're going through detox, they are producing copious amounts of mucus and coughing things out, which is a good thing. And so we follow that trend, and sometimes you get some temporary relief, but we don't leave you on, inhalers and things for too long. After completion of 4 weeks of raw detox, she was down to 186 pounds. That was 18 pounds in only 4 weeks. Her blood pressure ranging from 113/85, 132/89, 128/83, 135/80. This was overall equal to when she was on higher dose of medication. Repeat evaluation of inflammatory markers, C-reactive protein showed reduction from 2.3 to 0.4. So very significant reduction in C-reactive protein. And she had much less joint swelling and pain and was very happy with these results. So that was a 1.9 reduction. So 1.9 divided by 2.3. That was roughly an 83% reduction in C-reactive protein in just 4 weeks. Now, on average, our data shows an average of 30% reduction in 4 weeks. She had an 83%. Typically, somebody with a higher inflammatory process will have a more rapid drop. It's not always the case, but if we were to do a study with people with inflammatory diseases such as Miss Marin, I think we would see a much greater average drop than 30%. So post-detox, despite weight loss and better blood pressure and glucose controls and medication, she still had some chest pain and shortness of breath. In April, when she had some cooked foods, post-detox, and dealing with more stress, caring for a sick family, her pressure was very high, 187/109. She went up to ER due to chest pain and shortness of breath with it. Acute events were ruled out. The subsequent outpatient nuclear stress was normal. She also followed with a pulmonologist who was considering adding more steroids, but the patient wanted to try raw detox again instead. Steroids are anti-inflammatory, but so is a raw detox. And so this man was smart. So wait a minute, this nutritional intervention, not only did it decrease my inflammation, but I didn't get the side effects of a steroid. And so I prescribe steroids for patients in the hospital there having inflammation when they don't want to go on a raw detox. But she went on a raw detox, and it's a far more effective anti-inflammatory than steroids. And it doesn't have adverse side effects, it has collateral benefits. So, a steroid decreases inflammation with collateral damage. A raw detox diet reduces inflammation with collateral benefits or collateral enhancement. And so there's a night and day difference between those two interventions. I wanted to just point that out. So the fact that she didn't want to do steroids and wanted to do the raw detox was quite on. And she clearly knew from her experience with raw detox that yes, it has an anti-inflammatory effect and it has collateral benefit. Also, what I want you to notice is that after the detox and doing well, going back on cooked foods. These were plant foods, but they were cooked plant foods. And she had a recurrent of high blood pressure. So I want to emphasize, especially when you're reversing a chronic illness, you may have to be on a raw diet for a prolonged period of time to build up reserve. What's prolonged? It depends. Could be a year, could be 2 years or longer. And we've seen this a lot with patients with systemic inflammatory conditions. They do a detox first 4 weeks, 6 weeks, they're doing great. A little bit of cooked food, woof, back up. So that's something, two things I want to point out there. She noticed that carbohydrates like crackers, breads, or potatoes, many grains or processed plant foods made her shortness of breath and joint pain worse. These things probably not only had gluten in it, but they were cooked. And when you cook a plant food, it changes the biochemistry and stoichiometry of the molecule, and the body sees it as foreign. Follow-up in our office shows CRP that increased from 0.4 to 0.8. So it doubled. It wasn't as bad as it was before, but just notice how sensitive she was to a smaller amount of inflammation. So indicating more inflammation after adding some cooked foods, we recommend restarting detox and adding anti-inflammatory supplements like methylsulforamethane and curcumin. So you started back on raw detox, started treatment, infrared sauna, which also has anti-inflammatory. It also removes toxins from the system. It's a vasodilator. It helps with blood pressure. So the infrared sauna improves circulation, helps relieve pain. After a few weeks, she saw a rheumatologist who was shocked by the reduction in the autoimmune inflammatory marker. Shocked. So the rheumatologist stopped her Humira in May of 2022. I thought we stopped it. We should have stopped it. Shame on us. The patient's swelling and pain in her joints was greatly diminished. Her chest pain was gone. She continued to lose weight. She now weighed 166 pounds, almost 40-pound weight loss halfway through her second 28 detox. A lot of that's inflammation going down. The microbiome is correcting itself. So there's a lot of biochemical things that are happening beyond what we can measure. That's one. Two, if you look at the amount weight loss, and this is based on some of our data in the past. So I think her initial weight was 204, and she lost roughly 40 pounds at this point. So that's about a 20% reduction in weight. Now, when we looked at parameters such as anthropomorphic parameters like weight loss and compared to other biochemical changes, we saw there was about a 6 to 7 times improvement in biochemical changes compared to weight loss. So, for example, with a 20% weight loss, it's probably 120% improvement in other biochemical parameters at the cellular level, like inflammation or the like. So we know that the weight loss is great, but we know that greater things to a greater extent is happening at the cellular level, the subcellular level, many of which we can't measure directly at least. And so this is a great sign, not just the weight loss itself, because you can lose weight by any means, but we know that the weight loss is a sign that far greater improvements biochemically, physiologically happen at the subcellular level. She was offered muscle relaxant and ibuprofen. She had a 0 out of 10 pain many days, whereas she used to have 10 out of 10. She can now lift her daughter and do more strenuous tasks without difficulty or pain. She also was able to get back off her inhalers for asthma and was trying to learn mindfulness to help with breathing issues. She was also off her medications for famotidine, for nausea, and her nifedipine for hypertension by June. This was stopped after a few weeks of infrared sauna therapy. Hydroxychloroquine was stopped in August 2022. She did not notice any worsening of symptoms. Patients now only on vitamins such as methylated B complex, ethyl, MSM, curcumin, vitamin D. This was a huge change as she tried over 40 plus prescription medications in the past. After completion of the second detox, she was even able to gradually add some grains, cooked beans, and more plant-based fats in her diet without getting flares in the joint pain, eczema, or asthma. She gradually added those foods back to give time for her gut and microbiome to heal. This time she tolerated well while maintaining good blood pressure, blood sugar, and lower body weight. So medication weaning, number of prescription medication, 10 to 15 plus to 0 as of September. Weight loss from 204 to that's 55 pounds to 149, BMI from 33 to 24.7.8, 34 to 24.8. So symptoms: fatigue, severe joint pain, swelling, dry, itching skin, reduced mobility, inflamed nodules, fluctuating blood pressure, high blood sugar, weight gain, nausea, constipation, cold fingers, shortness of breath, chest pain, migraines, anxiety. Now it's just intermittent shortness of breath, aching in the fingers, less intense than before, inflamed nodules. And here in October 2022, the patient told her gynecologist she no longer needed hormone therapy to maintain her pregnancy. This was huge news. She had also relied on hormone therapy to assist with prior pregnancy, and unfortunately, it did not always help. Furthermore, her body had adapted to have a normal response to a wide variety of plant foods. The grains, beans, that used to worsen her dry skin and inflamed joints are now not causing these problems. She ate mostly raw with some cooked plant foods. Her weight went down to 149 pounds, BMI 24.79. That makes a total weight loss of 55 pounds, and BMI is now normal as well. She finally feels like she lives pain-free most days. And here's the before image with a beautiful young daughter, intermittent, and an after.